is our system is set up in the opposite way than it should. And Dr. Calderon said this beautifully, is that our system is very fragmented. First of all, one hand doesn't know what the other hand is doing. If I as a physician see a patient and a cardiologist sees that same patient 2 days later, I don't know what the cardiologist did, and the cardiologist might be doing tests that I've already performed, because there's no system in place yet that we communicate properly with information. And that increases costs. It's called duplication of services. If I do an echocardiogram in my office and it costs Medicare, let's say $300, 2 days later, they might be at the cardiologist, and the cardiologist is going to do the same test. That's doubling the services. If those services are then doubled on millions of lives, tens of millions of lives, you see the cost that's there as well. In addition, we have to work as a team, and to work as a team, we have to have the proper payers. If I go see a patient in the hospital, every day I see that patient, I get paid money, every day. So if I see that patient today, tomorrow, the next day, I get paid every day. The hospital, though, gets paid again, one time for that visit, for the whole service. So if the patient is there for 3 days or for 100 days, the hospital gets the same amount of money. So we're not aligned as to what is best for the patient and what is best for our system. Because a doctor could easily say, well, instead of discharging the patient today, I'm going to wait till tomorrow or the next day. Because we're incentivized to keep patients in the hospital, and that's the wrong thing to do. We're incentivized to do more tests. Okay? For me to use my brain and to try to help a patient, I get paid very little. But for me to order a test, I get paid a lot. Okay, so that's a big problem. It's a huge problem. Okay? If I see 15 patients in my office, and I do everything properly to help this person with their diabetes, with their blood pressure to be under control, with their depression, I get paid a certain amount of money. But if the internist down the hall sees 30 patients in that day, regardless of what kind of care they get, guess who's going to be driving the Mercedes? It's not me, okay? It's the doctor who sees 30 patients, because we're getting incentivized to see more patients regardless of the outcomes. And what's going to be happening now with the reform is that all of this hopefully is going to start changing.